Hello, and welcome to this video training on the system to work Medicare Facebook leads. So we'll dive right into it right after this. I'm back. So here we have my system I developed in acquiring Facebook leads. I've had some time to figure out the process to working these wonderful falling from the sky leads. The lead is acquired by a 64-year-old who is searching for Medicare information, like they all do online nowadays. When I first got started in Medicare supplement enrollments, there was no internet that people could search around on, but I saw it clearly come more and more that people, when you talk about Medicare, they're going to search it online, and so that's why we have to be a presence there. People go to our Facebook fan page and register their information. Voila, magic, we have your lead. These are people from all over California. Exclusive leads, turning 65 in the next 1 to 8 months. This process can take up to 5 to 6 months to work these leads, but it pays well, so you need to be patient. Their open enrollment is 3 months before their birthday month. That's the goal, and they often reach out online to learn and understand it all. That's where you come in. So because these are internet leads, then the usual prospect is a suspect till they know you are working for them. You need to earn their business, but first you must get their attention. This is the ad that the people are registering at, requesting you to call them and help them. They provide their name, email, birthday, and zip code. A sequence of email letters I have created, I am making available to everyone in our team, so you too can benefit from these unique leads. For starters, they are wanting help. Let's get that straight. It's urgent you give them a call or reach out to them by email. Both is best, and we already know their questions, right? They're the same questions others have asked before at this time in their life. Reassurance is all they desire. What will Medicare not pay for? How do I enroll into Medicare? What will my Medicare cost be? How do I know what plan is right for me? Silly people, that is where we come in and why they need us to tell them what Medicare will not cover and verify their doctor accepts Medicare and is in the network of the right plan in their county. Tell them Medicare is not the same as it was for their parents. It's different now. You are a trained professional that will guide them. Now I will help to give you the system and emails I have developed to teach them through our Email Medicare series. They have given us permission. But first you need to do one thing. You saw the information they provided to us. You must get prepared, but don't let the cat out of the bag yet. Go to Medicare.gov and look up the MAPD, Medicare Advantage Part D plans in their county based on the zip code they have provided. You will be surprised. Sometimes there is no MAPD plans in their county. So you only need to discuss the 10 standard Medigap plans, the Medicare supplements. Be ready to give them valuable information based on your due diligence at Medicare.gov. Since plans are filed by county, do a little research before you call the prospect. Don't tell them everything all at once. You need to drag this out over the months till their open enrollment period. Sign them up 3 months or less before their birthday for the effective date, day 1 of their birthday month. This fills your pipeline and they will convert on a regular basis. Here are the 10 standardized Medigap plans for 2017. Part A deductible at the bottom right you can see is $1,316. And the Part B deductible premium, everybody pays Part B premium unless they're on Medi-Cal or Medicaid, is $183. That's gone up dramatically since recently at $121 in just the last 2 years. On the left side you can see the basic benefits, how Medicare works. Here's the Medicare.gov resource to you, the website. I use it almost every day. You can see the green button here where it says find a drug plan, find health drug plans. I'm going to show you that right now on a live demo. We'll just show you everything that you need to know about using Medicare for these leads. So we have a lead came in. This is what the information you would gather from the Facebook lead for Medicare enrollments. And so what we have to work with, really what we're doing right now, is checking the zip code. So I'm going to copy that one, and we'll go into, we might try a couple anyway. We're going to go right in here to find a health and drug plan. As an agent, I like to use it as well frequently for searching up the different plans in these zip codes. So what we're doing right now is we're taking that Medicare Facebook lead and we're taking their zip code. That's why it's required for them to put it in as they register for more information about enrolling in Medicare at the Facebook fan page. We can put it in Medicare.gov and see what plans are available in their area. Now, the plans specifically we're looking for are the Medicare Advantage plans, the ones that are regulated by CMS. However, if we find there are no plans available, some counties don't have any Medicare Advantage plans at all. They're required to have Part D plans, but they just don't have the masses of people to actually have it make sense to have any Medicare Advantage plans. No networks or such. So we're going to skip the drugs here. We don't want to put those in, but if you popped in the drugs here, and you can build a list. I've built lists as long as 16 drugs long, and then it points that client's drug load or burden over to the plan that has the best formulary to service that drug load the best possible way for the less cost. So in looking for the plan in this zip code, if there are no Medicare Advantage plans, then you can only sell them Medicare Supplement. I have clients that are up in the middle of nowhere in the mountains that just don't have any other plans available to them in those areas. They're just not populated. So here are the plans. It starts out with Original Medicare, and then we have Kaiser, Humana Gold Plus, Humana Gold Plus, Anthem Blue Cross, MetaBlue AARP Plan 2, and AARP Plan 1, Humana Choice, Humana Gold, Rocky Mountain Green Plan. Okay, so you would call up the client here that you received a lead on, and you would dial their phone number, and then you would talk, Connie, hi, this is Kevin Wood. I'm actually your Medicare advocate. Wanted to introduce myself. You're registered online at my Facebook page for Medicare enrollments and wanted to answer some questions. Just to make a brief introduction, I've been helping people like this for many years, and you never pay me for any time. I get paid by Medicare when we enroll your plan. And this way, by working with a Medicare advocate, you're going to get the best plan possible for your needs, for your healthcare needs, and you're going to make sure you keep your doctor if you want to keep your doctor. So eventually, what you want to do is you want to work with Join.me, screen sharing platform, and all you have to do is you just get a screen share set up, and they can watch you work on your desktop and show you this stuff. And then you're educating them. Let's look at Calabasas County zip code. 91302. Copy that. Put it in here. Find health and drug plans. And then you put in the zip code. You have to catch that box. It moves around. Find plans. Click I don't know and I don't know. I mean, you don't have to click anything here. It doesn't really have any results that would be changed. Again, at the drug, like I said, you could put in there metformin for diabetes, and as you put that in there, metformin, and then it comes up here, HCL, you click on that, it's confirmed 500 milligrams, every month, add to drug, and then you get the name down here at the bottom showing that particular drug, and you could build that out to as many as you need to. So there's metformin, 500 milligrams, and I've had, like I said, as many as 16 of these drugs. So now we're going to go on forward and click down here. Since we have something in there, my drug list is complete. And now we're going to go forward to choosing a Medicare pharmacy. You do have to choose one. So just add a pharmacy. This one here, Buena Vista. Continue to plan results. Medicare health plans. Continue to plan results. And we'll get those MAPD plans. And you could search for just drug plans as well. So here we have Original Medicare, Central Health Medical Plan, Alignment, that's one of them I like. That's a great plan. Classic Care. Care First, we have that one as well. So those are the ones. Anthem we have, Humana we have, and AARP. So you can see here, AARP is not even in the area. Okay, and so I'm going into the Tulum County 95370. We'll skip through the plan for drugs. Wanted to get in here quickly to show you the results. As expected, the plans that are Medicare Advantage plans do not exist in the Tulum County area. That shows you at 95371. You can only sell Medicare supplements there, and I would recommend the best ones to sell there is the N plan for Nancy or F plan for Frank. Those would be the either very best or one that's a lower cost premium and covering still quite a good coverage. That's it. In this series we educate. The first email is an introduction connecting them to the Facebook fan page and laying the groundwork that you are the advocate for this individual. This email will include some attachments and building a foundation of trust. The subject line will read from your Medicare advocate. That's you. I'll read it off so that you can just have it and clearly see what it says. And I can email you all these letters upon your request. Hello, I just left you a phone message. By way of introduction, you went to our Facebook website and requested more about your upcoming Medicare enrollment. Your time is coming. FYI, you have a limited window of time, 3 months before your 65th birthday, to make your Medicare health plan choice. Sure, you could try to enroll on your own, but with so many options, you might miss getting many benefits you just weren't aware you qualified for. My name is Kevin Wood. My phone number. Call me if you have any questions at all. I am your advocate. I am here to help you through the Medicare maze and mayhem. Number one, your Medicare will start before you know it, ready or not. Part A is hospitals, comes to you automatically because you worked in the system for 10 years minimum. I can teach you how to be ready. Have you called to enroll in Parts A and B through Social Security? They prefer you do this registration online at www.ssa.gov. I can help you with this as well. Number three, or maybe you are already taking your Social Security benefits. In this case, you will be enrolled automatically into A and B. I can verify that for you with Medicare. I am on the first name basis there. Did you know Medicare is open 24/7? However, there are many Medicare Advantage or supplement plans to choose from. Number four, do you want the complete plan or the partial plan? Number five, how about the drugs you take? Will they be in the formulary drug list of your Medicare plan? Is keeping your same doctor important to you? Number seven, do you plan to travel and don't want a network to tie you down? I will make sure no mistakes are made so you get the best program for you and your health care needs. That is where I come in. You never pay me. However, Medicare pays me when we complete your enrollment into the right plan for you. It is a process and can be confusing to most new to Medicare beneficiaries. Needless to say, Medicare is a moving target. Every year it changes. It is imperative you choose the right plan for your lifestyle and healthcare needs. I will also keep you up to date in the future as well when changes occur every year. Please call me and we will begin this journey into Medicare and make it easy on you versus trying to figure it out on your own. I do everything over the phone. We should talk soon. Just 5 minutes is all. If you don't call me, I will be calling you. These are the email attachments, and I attach them to that last email. Also send a picture of your family so they know you are normal and for real. This makes a big difference. Also email them a picture of your business card, and at the bottom of this Medicare flyer, I can change the personal information to yours so you have it to make copies of and hand them out to people as you might see them in their homes, or also you can just email this as a PDF. Tell me what Medicare doesn't cover. Let's be clear about what Medicare will not cover. As you prepare to enroll into Medicare on the first day of your birthday month, or if you are already on Medicare, possibly you have disability, Social Security income, read on. Medicare will not pay for what Medicare will not pay for. As a Medicare advocate, I get asked this every day. So here it is, the short list. Number 1, some Medicare treatments that are still in trials are not FDA approved, not paid for. Number 2, long-term care, that is chronic. Medicare will only pay 20 days of acute stay for recovery assisted care, but with limitations. Plus, you pay $162.50, that's as of 2017, copay for the 21 days to 100 days, totaling 100 days in a rehab center only. However, cataracts are paid for. Sometimes there is a small copayment required that highly depends on the plan you choose, whether it is Medicare Supplement versus Medicare Advantage. There is a big difference. Dental and vision, what? Nope, not covered. This happens to upset people the most. So I recommend getting a separate dental plan for lowering your out-of-pocket costs, including glasses as well, not covered. For this purpose, I have provided you a dentist lookup link and also the website Direct Access Dental. You can add vision if you want. It's only a minimal $13 a month. This discount plan is the bomb. Here you can see their summary of benefits online. A discount plan is better than insurance in this case. Traditional insurance has limits to your benefit ranging from $1,000 to $3,000 per year. I had one client save $8,000 on his treatment plan on a discount plan. Click the link below to see if your dentist is in the network and if your dentist takes this plan. If your dentist is not found, you can call me for a different plan option at my phone number. Ask for Kevin. If you have questions on Medicare and what plan to enroll in there, they give you a call as well. If you have questions on Medicare and want a plan to enroll in there, then give me a call as well. In 17 years, I have enrolled over 2,000 people. I am an expert, and you never pay me anything ever. I really worry about people getting in the wrong plan. I have had this happen. Then they call me, and I have to unravel the whole ball of string, then correct the problem. Visit us at grandpasinsuranceSolutions.com. This is the second email attachments that I add on to the email. It's a letter that I have mailed out for years and brings me people turning 65 all the time. And they're on a ticking clock. The thing you have to remember is they have to enroll. They are watching the clock tick by. And then there's the Mutual of Omaha Insurance Company 10 standardized plans they call Medigap plans nowadays. It's not a very large picture, but there's one in this earlier program. Third email, you should call them now and say hi. This email should go out in a phone call as well, or even call them in the beginning is fine too. The subject line would read, you want answers to Medicare. Hello again. Medicare can be confusing sometimes. I have attached 2 Medicare books, and I don't expect you to read them. I am your Medicare expert. It is better if I explain to you the important stuff. You will be bombarded and palpitated by mailings that confuse you even more about your Medicare benefit options. Medicare is a moving target. Most people enroll into Medicare and work with a specialist like me. Senior health care has never been harder to grasp. If you haven't made your plan choice yet, or even if you have, you can learn how to get more from your Medicare from me. Don't miss outside benefits that you may qualify for but didn't know about. I've even seen it happen in my 15 years as a Medicare advisor. Knowledge is power. We are Grandpa's Insurance Solutions. Our mission is to guide and educate individuals through the enrollment process into Medicare with the best healthcare program possible to meet their individual needs. You never pay us. You registered on our website for more information or help, and I called you and left a message. I'm Kevin Wood in Oakdale, California. I've been enrolling people into Medicare 15 years. I work over the phone. Please call me and we can start your Medicare orientation process. There are many programs in Medicare you may qualify for. To save more money on health care, it's my job to streamline this process and make it fun. Pop quiz: what will Medicare not cover? I will explain everything to you and make it easy. Call me and make Medicare work for you. And these are the attachments. These are full-blown books. Pages were about 90 pages on the Medicare and You 2017, and then the Choosing a Medigap Policy, also a resource and many, many pages. It's not just a small pamphlet. Discuss the Medicare premiums, copays, and deductibles. Hello, as your Medicare advocate, I'm here to answer all your Medicare questions you have. I helped thousands of people properly enroll into Medicare. To avoid the headaches, just call me and I will make sure you're on the right path with Medicare. Your open enrollment clock is ticking. You are in a position for enrolling in the open enrollment right now, 3 months before your 65th birthday. You never pay me. Call me with any Medicare questions at all and claim your free gift. If you recall, you contacted me through the Medicare Assistance Facebook page. You will have ease of understanding and peace of mind working with a licensed professional. Enroll into all the benefits you may qualify for, and they are free, but you don't even know about them until you talk to me. For example, how about free prescriptions? How about a free gym membership to your local gym? How about over-the-counter products from toothpaste, aspirin, all free? As many consultations by phone that you need for me for free. Help and knowledge on additional TRICARE, federal, and VA benefits free. Help and knowledge on LIS, low income subsidy for RX savings. Medicare will pay your part if you qualify. This is what I can do for you just for starters. Have you seen the new copays and deductibles to Medicare? Wow. See, I need to explain a few things to you so you are in the know. Knowledge is power, right? Learn how you can enroll on a Medicare plan and pay no premiums. Bullet points on Medicare history. Go to this link. Medicare premiums, deductibles, and copays, zero premium plans became available since 2005. The Bush administration saw all the baby boomers, that's you, soon to come, 50 million of them, and they saw the burden on Medicare, so they devised what is called the privatization of Medicare to start in 2005. They introduced Part C and D Medicare. They introduced Part D for drugs and Part C to outsource your benefits to a private insurance carrier of your choice. Many plans are no extra premium to your Part B. Many plans are no extra premium to your Part B premium, now $121 per month. Unless you make more than $85,000 per year, you might well pay a higher Part B premium for yourself. Now these are the attachments for Part D drug plan that are sent on that last email. Starting as low as $0 per month, scroll through the whole 2017 Medicare costs from top to bottom at right. And these are the updated ones, and we'll go through them. And the donut hole, this is an example from 2015, the donut hole is vanishing, But you can see here, if a senior citizen looked at this, and I like to email it to them, they just get confused. And then that's why they need you. So here, Medicare Part A, the Medicare Part A premium is paid because you worked in the system 10 years or 40 quarters. If a person was an immigrant coming to America, they don't get this for free. People complain about, they think it's for free for immigrants. It's not. It would cost them $413 each month for Part A Medicare. Hospital stay, 2017, you pay $1,316 for the deductible per benefit period. And that is a 60-day window for each benefit period. $329 per day for days 61 to 90 days of each benefit period, and double it up to $658 per lifetime reserve days after 90 of each benefit period, 90 days. So the skilled nursing facility stay is 0 from days 1 to 20 and days 21 to 100, which is the remaining 80 days, plus the 100 is a total of plus the 80 is a total of 100 days. The 80 days are $164.50. Then all costs are paid for after that by the beneficiary. Part B, monthly premium, $134 or higher depending on the income. So there you have it. You can read further on that if you pause the video. This email goes out, I think we're on the 4th one. Medicare concerns that I can clear up for you. Are you heated up over Medicare like our hot summer days? I hope you are staying cool. It's Kevin Wood here again. Have you got this Medicare thing figured out now? Just when you think you have it understood, something else is mentioned. So believe you me, having help from a professional is the way to go. I will assist you with your Medicare enrollment completely from top to bottom. The clock is ticking. If you are all taken care of, then great. But if you have not made your move, I highly recommend you call me so I can guide you on these steps. Call me to review your Medicare healthcare plan options. I have attached a few items for you. Know this, there are 3 ways to go with Medicare. First, Original Medicare Part A and Part B. Add Part D. So you have A and B and Part D is one way to go. And the second way to go is Part A and B and D and a supplement. Or Medicare Advantage with Part D embedded in the plan. So those are the truly 3 ways that you can get your Medicare benefits. What we will look at to compare at these 3 options is how you receive your care through networks like HMOs, PPOs, or no network options like PFFS plans, etc. Choice of doctor. Is it important to you to keep your doctor? What is the premium cost? Some plans are 0 cost in addition to Part B premium. It went up this year and will go up in years to come, as well as annual Medicare deductibles too. What plans have co-pays and which ones do not? This is good to know and could save you some money. There are 10 standardized Medicare supplement plans. Not all companies offer all 10. Medicare Advantage, called Part C Medicare, has 6 different companies that work like a major medical plan. I will make sense of it all, and you never pay me for my knowledge. So I look forward to assisting you in the understanding on how Medicare works and what it will and will not pay for regarding their services. More about Part D. It seems to be one of the most confusing things for people on Medicare is that whole Part D thing. Part D vanishes. The donut hole is now at 40%. A few years back it was 100%. During the donut hole that a client would have to pay for their drugs, 100% out of their own pocket. Now it's at 40%. It's going to continue to vanish up to 2020. How it all works for buying drugs. This benefit works on a 5-tier plan. So let's go over these tiers. There are 5. Tier 1 is for generic drugs. A 30-day supply will be typically $5. In some cases, they will give you 90-day supply for free in mail order. Tier 2 is generics that are not approved. 30-day supply, $10 per month for 30 days. And again, on mail order, you could have a deep discount. Tier 3 are brand names that are approved. 30-day supply, typically $40 to $50, depending on the plan. These are numbers that are generic numbers. Could be higher or lower. Tier 4, brand name, non-approved, about $90 to $100. And Tier 5, these are for injectionable drugs. They are 33% of the retail price. So when a copay is hit by the beneficiary of $2,455, they enter into the donut hole, and during that time they have that 40% of retail cost out of pocket. And then once they're out of the donut hole, by hitting total cost out of pocket between them and their insurance company paying the copays at $4,800, they would be exiting the donut hole and down to paying the 5% catastrophic coverage. Number 5, email. Time to have a conversation with them. Call them now and set up a Join Me. It's free. If you haven't already done it, which you should have done it by now, don't wait any longer. Hello from your Medicare advocate. Call me as soon as possible about your Medicare enrollment. You are on the doorstep. I am trying to contact you as your Medicare advocate. Just a simple conversation could do wonders for you to be sure you are all set. Have you enrolled into Medicare through your Social Security Administration already? I hope. As a rule, people preparing for Medicare almost always have questions. The main thing is to understand there are many plan choices and not all are good fit for some people. Again, we need to talk. Furthermore, Medicare is predictable. It has those nasty copays. Medicare policies have a monthly premium, but that is all you pay. Nothing more out of pocket on a Medicare or Medigap policy. Say your annual premium is $1,340, then this is budgetable and predictable cost. It is also your maximum annual out-of-pocket. You don't pay for any copays or deductibles when you have Medicare A and B and a supplement. See a good option here for this specialized coverage. It's a dental and vision protection plan, and you can check that out of this link. Call me to be sure your dentist is already accepting this plan to verify that. Medicare also does not pay for long-term care. Are you a veteran? I can show you how to apply for Vets Aid and Attendance pension that pays for these costs. If you are a veteran, then I can show you how to have another company pay for your existing nursing home costs for your first years. The clock is running out and we need to speak. Call me right away. You may be missing out on benefits you just didn't know about. You may qualify to save big money. Call me to find out. Here is where we talk about the Part B, late enrollment penalty. There are penalties for Part B and D, as in drugs, only. In most cases, if you don't sign up for Part B when you're first eligible, and that means they don't have any other health coverage. If they're working and it goes beyond their 65th birthday, they can have Part A and wait to sign up for Part B without any penalty at all. But if they waited and lost their group plan and just didn't do the sign up for Part B, 8 months later from when they left their group plan, they will incur a Part B penalty. Your monthly premium for Part B may go up 10% for each full 12-month period that you could have had Part B but didn't sign up for it. Also, you may have to wait until a general enrollment period from January to March to enroll in Part B, and coverage will start July 1 of that year. That's called the Medicare General Enrollment Period. Usually you don't pay a late enrollment penalty if you meet certain conditions that allow you to sign up for Part B during a special enrollment period. If you have limited income and resources, your state may help you pay for Part A and Part B. You may also qualify for extra help to pay for your Medicare prescription drug coverage. Understand the process and follow the system. You should call them when you get their name right away. Just as an introduction, here is what you might say. Hello, their name. I am Kevin Wood, calling because you registered at our company's Medicare fan page on Facebook for people turning 65. Do you have a quick minute? I am letting you know the free counsel will provide you enrolling into Medicare. I have guided many people through this process. Can I let you in on a secret? If you are taking your Social Security, then you will automatically be enrolled into Medicare. If you're not taking Social Security benefits, then it is preferred you enroll at socialsecurity.gov. I can help you with that as well. Now I have your email as confirm email. I have your birthday as, this is your birthday we are shooting for. So we have some time and a few things to learn through this once in a lifetime enrollment process. When can I call you back next week to tell you other Medicare nuggets and secrets? Is Wednesday or Thursday better? Are you a morning or afternoon type? Great. I am open at 11 a.m. or 4 p.m. Your pick. I look forward to teaching you all about Medicare. Watch for my emails. Check your spam folders. Talk to you later. Bye. Now, when you're talking to these people and they already enrolled in Medicare, you're going to miss some. They get somebody knocking on their door or meeting them at their house. You're going to miss some, but you're going to get a lot of them because you're going to be out way in front of, with their permission, way in front of other agents who are marketing to them only 4 months before their 65th birthday. So by doing so, and let's say someone even registers at Facebook and that's about 2 months before their birthday and they already enrolled in a plan, then you need to talk to them about the dental and vision plan, the long-term care, and this cancer, heart attack, and stroke insurance. Let's summarize Medicare. This is not enough. You need a backup. Just that card, not enough. Medicare supplement and chronic illness plans must be looked at, must be discussed. Talk about all possibilities. 1 out of 2 people get cancer, while heart disease is the #2 cause for women's mortality. Strokes are rampant. I have a cancer, heart attack, and stroke that pays $20,000 when Medicare falls short. It's only a question of when. Many treatments are not covered, holistic not covered, some medications, travel are not covered. Myself, I have that policy. And so here you can pause this and do more reading up on it. I'll just go and look over the right side here. As an agent, you should have this policy, or don't talk about it. How could you expect your client to be interested if you can't say, by the way, I have this policy, as should you? That's what I've said to people, and it's helped them make the decision to buy this policy. This does not apply to policies you are not at the age to have, like Medicare, unless you're on disability, or long-term care, and that should be bought or paid for in their 50s. It has been great to see many carriers add these long-term care or chronic critical illnesses plans or benefits as free riders to their final expense plans. I especially like the return of premium riders if they are not too pricey. Depends very much on the client's budget. It is my firm recommendation to discuss all the options so as to take care of their every need. You have the fiduciary responsibility to do that. Ask them many questions to solve their problems. Be the hero, be professional, and get paid doing it. This is the join.me website you should use. As soon as you can, get on there with them on the phone and show them join.me. Every time you log in, and it's free, you get a new code. They would put that in their address bar and join your meeting, and you will be sharing your screen with them. I've done it thousands of times. So remember to go in there and experiment with this web site and this web software. Good systems are flexible, not rigid. If we can improve this system, then let's talk. Like shooting fish in a barrel, you have a great opportunity with Medicare to get wealthy. The best residual income ever. Get busy and get CMS certified and enrolling 10,000 people daily turning 65 in America every single day. And I can be reached at this email. Thanks for watching. Call me if you have questions.